Well, good morning, everybody. Today, we are here to talk about the unacceptable disparities in maternal health outcomes in this country and a suite of legislation that my colleagues and I are introducing to save moms' lives, the Black Maternal Health Momnibus Act of 2021. This legislative package builds on legislation we first introduced nearly a year ago, and it's grown to include 12 bills to save lives and end racial and ethnic disparities in maternal health outcomes and promote justice and equity for Black women and all birthing people. I'm honored to be joined by my good friend, Senator Cory Booker, a longtime maternal health champion in the Senate, and Congresswoman Alma Adams, the co-founder and co-chair of the Black Maternal Health Caucus. Last year, I was proud to stand beside then Senator, now Vice President Kamala Harris, and more than a dozen members of the Black Maternal Health Caucus to introduce the Momnibus for the first time. In the years since the Momnibus was first introduced, an estimated 700 women will have died from pregnancy-related complications, the majority of them preventable. And for every pregnant person or new mom that we've lost, 70 will have nearly lost their lives in an attempt to bring life into the world. And that's nearly 50,000 people a year. Layered on top of these statistics and the stories behind them is a global pandemic, which itself highlights the urgency of the Black Maternal Health Momnibus Act. Not only has the coronavirus increased risks for adverse birth outcomes, it has also exacerbated the drivers of maternal health disparities that long predated COVID-19. Over the course of my lifetime, maternal mortality rates have been rising in the United States while they fall around the world. And the pregnancy-related mortality ratio for Black birthing people is 3 to 4 times higher than the ratio for their white counterparts. During COVID-19, we've seen Black, Hispanic, Indigenous, and Asian Americans face higher rates of exposure to the virus and suffer more severe health consequences upon infection. These disparities are unacceptable. The hour for bold action has arrived, and bold action is what the Momnibus represents. In addition to coronavirus-specific policies in the package that I'm proud to lead with Senator Elizabeth Warren, the Momnibus includes critical investments in community-based organizations, maternal mental and behavioral health care and support, and programs to grow and diversify the perinatal workforce. This year's Momnibus also includes the Protecting Moms and Babies Against Climate Change Act, an important bill that I'm proud to be introducing with Senator Ed Markey. I'd like to thank Senator Booker for his leadership on the Momnibus in the Senate and all the senators and representatives who joined us to roll out this package. Most of all, I'd like to acknowledge the leadership of the many Black Maternal Health Caucus partner organizations that we've worked with to develop this legislation. We know that we'll be turning to you again to get the Momnibus signed into law. We have a lot of work left to do, and that's why I feel lucky, so blessed to do this work with my partner, Congresswoman Alma Adams. At this time, I'd like to welcome Congresswoman Adams to make opening remarks.
Well, thank you, Congresswoman. It's good to see you this morning. Good morning to everybody. Thank you for joining us today. I am so proud to join with my co-chair, co-founder, Representative Underwood, and the great senator from New Jersey, Senator Booker, to unveil the Black Maternal Health Momnibus Act of 2021, a comprehensive 12-bill package that tackles one of the greatest public health crises of our time. And so with the sort of a historic coalition of health care providers, Black mothers, policymakers, researchers, activists, and maternal health advocates, we have crafted a collaborative, targeted, and timely set of policies to improve maternal health outcomes for Black pregnant and postpartum individuals, particularly during this COVID pandemic. In Congress, this mission began back in 2018. When then Senator Kamala Harris, now our Vice President, and I worked with the Black Mamas Matter Alliance to introduce a resolution honoring the first Black Maternal Health Week and a bill called the Maternal Care Act. But for me, it's personal because this work began when my daughter, Janelle, almost became a victim of this crisis. a physician overlooking my daughter's complaints of pain in her abdomen, not listening to her needs as a Black woman. Their dismissal of her pain almost cost my daughter her life. And since the launch of the Black Maternal Health Caucus over the past 2 years, Congresswoman Underwood and I have talked about how these terrible inequities in our society and in our healthcare systems have stolen countless moms from their children. For every mother loss, there are hundreds of near misses. So when we think about how important mothers and grandmothers are to their communities, we should recognize that moms touch so many lives, even outside their immediate families. My daughter is not only the mommy to my two amazing grandchildren, two of four, my son has two, but she's the principal to all of the students at Reedy Fork Elementary School. So as you can imagine, this issue is deeply personal for me and to so many others. Sadly, not only have we been battling a Black maternal health crisis now over the past now 11 months, we're fighting the public health emergency of the COVID-19 pandemic. And as I've said from the start of the pandemic, this is a crisis within a crisis. And so we know that Black and brown bodies have borne the brunt of the pandemic, and that health disparities that existed before COVID-19 have been further exacerbated. And so we've got a lot of work to do, but we will not stop shining a bright light on the racial health disparities and the unacceptable outcomes that Black people continue to experience here in this great country. And so today we are reintroducing the Black Maternal Health Momnibus Act, 12 separate bills, which build upon existing maternal health legislation by filling gaps to comprehensively addressing every dimension of the Black maternal health crisis. And since the last introduction, we have received feedback that has helped us to expand the scope and the focus of the Momnibus, which has allowed us now to add 3 new bills to this package. Throughout the process, we remained very intentional about centering the voices of Black women and ensuring that Black women-led organizations are consulted often. The Momnibus makes investments in social determinants of health, community-based organizations, the growth and diversification of the perinatal workforce, improvements in data collection and quality measures, and digital tools like telehealth and innovative payment models. In addition to direct efforts to improve Black maternal health outcomes, the Momnibus focuses on high-risk populations, which includes women veterans, incarcerated women, and Native Americans. It focuses on environmental justice because recent studies have reinforced the linkages between man-made climate change and the toll that it takes on pregnant women and their infants. The Momnibus provides critical funding for community-based organizations to identify climate change climate change related risk for pregnant and postpartum people and their infants, and provide support for patients. And since the beginning of COVID-19, over 64,000 women that we know of have contracted the virus while pregnant. According to 2 CDC morbidity and mortality weekly reports, we've learned that pregnant women might be at an increased risk for severe illnesses from COVID-19. Black women were found to be disproportionately impacted during one of the times that should be the most joyous of their lives. And that's why this year our package specifically addresses this crisis within a crisis with these new bills: the Maternal Health Pandemic Response Act and the Maternal Vaccination Act. Respectively, these bills make targeted investments to advance safe and respectful maternity care and improve data collection, surveillance, and research on maternal health outcomes. And finally, I want to just make one comment about the bill that I'm sponsoring in the package, the Kira Johnson Act. When I introduced her bill for the first time last year, I told her story. In 2016, Kira Johnson checked into a hospital with her husband to give birth to their second son, Langston. Kira was an entrepreneur, world traveler, mother of one healthy boy already, and a Black woman, and nor as a Black woman, she didn't make it out of the hospital alive. So she died from hours of neglect, and severe hemorrhaging nearly 12 hours after delivering Langston. She deserved better. Kira Johnson mattered. And it didn't have to be this way. However, Kira wasn't the last one. On April 17th of last year, a 26-year-old woman, Amber Isaac, a beautiful Black mama, tweeted that she, and I quote, "I can't wait to write to tell about my experience," she says, "during my last 2 trimesters dealing with incompetent doctors in her hospital in the Bronx." On April 20th, her doctors induced labor, produced with an emergency C-section. During her delivery, Amber's heart stopped as the medical staff removed her son, Elias. And during the pandemic, and due to the pandemic, the hospital didn't allow Amber's partner to be in the room during the delivery. And later, they learned that she had HELP syndrome, known as preeclampsia. Little Elias was born more than a month early, but he was healthy. And on April 21st, his mother, Amber, was gone. So for Amber, for Kira, for all of the mamas who we've lost to this crisis, or have almost lost due to errors and bias in care, we have to pass the Momnibus and the Kira Johnson Act. It makes investments in community-based organizations that are leading the charge to protect mamas. For decades, the maternal mortality and morbidity rates have gotten worse for all mothers, but especially for Black women whose health outcomes are further compounded. So this year's Momnibus ensures that our healthcare systems, our providers, and society will truly make Black maternal and infant healthcare a priority. So I look forward to working with my colleagues to get the Momnibus passed into law, and we're going to get this done. We're going to get this done for Black mamas because our mamas can't wait. And I want to thank you. And at this time, it gives me great pleasure and an extreme honor to turn this mic over to my brother, my friend, Senator Cory Booker of New Jersey. Senator Booker?
I can't thank you enough for your words and, unfortunately, your painful stories of Americans who are facing what I think is a national shame. We are the wealthiest nation on the planet Earth, but yet we have maternal mortality rates that are stunningly at the bottom of the wealthiest nations in terms of outcomes and health outcomes. And when it comes to people of color, birthing people of color, the record is even more shameful. And so today I am honored to stand with two women who are congresswomen, who are titans, who are champions, who are light workers in this effort to bring this shamefulness out of the shadows and to call upon our nation to rise up to this challenge. Indeed, the outcomes that we have are not predestined. They are the result of policy choices, or maybe better put, they are the result of us failing to make policy choices that would help us to affirm who we say we are, a nation that believes that people have inalienable rights, this right to life, this right to wellness and well-being. This ideal that we have in America is something that we have to work on. We know that birthing people of color, as we are seeing savagely in this pandemic, is just revealing in stark reality the challenges we have with the disparities across the entire health system. We know that these existing disparities in our healthcare system continue to be saddled with unacceptable bias and racism, where we see the pain of Black women in particular too often being minimized by health professionals. And the stories that you heard my colleagues speak to, the lives that they spoke to, are too often relegated to silence in the shadows and ignored by our society. And so we together, leading in the Senate and in the House, have put together this Momnibus. We know that Indigenous and Black women are 2 to 3 times as likely to die from complications related to pregnancy than white women. And we know we live in a nation where the deaths from pregnancies alone are unconscionably high. We need this bold action in the Momnibus, these conscious, deliberate policy choices to affirm the ideals of our nation, to better establish the inalienable rights, and for our treasure for our values as a country to really be real. This package, as was said, is 12 common sense bills that will save moms' lives and confront the deadly disparities, the injustice, the darkness in the maternal health crisis, and make sure that we overcome and change these outcomes. This is an issue for all Americans, not just African Americans. It's an issue for all Americans, not just women. We live in a nation where we have interwoven destinies, where we need each other, where our success as individuals relies on our success for the whole. This now is a test. Can we overcome this poverty of empathy, this poverty of action, and bring about the abundance and the wealth that happens when we elevate human life, when we elevate the lives of mothers, when we focus on the truth that has been too long saddled with lies, that we cannot change these outcomes. I am so grateful that in the House and the Senate, we have a package of common sense bills that can make for justice. And I want to give again my particular gratitude to Representatives Underwood and Adams for their incredible leadership. Thank you.
Well, thank you, Senator Booker. And I want to thank all of our colleagues who have introduced this legislation. Obviously, they couldn't be with us due to COVID-19 precautions, but they have been such committed champions on this issue. Together, we're doing the work that's needed to save our moms. I look forward to advancing these bills in the coming weeks and months, and we're happy to take your questions at this time. I do want to just say, I know that Congresswoman Adams has other commitments. I know that Senator Booker has other commitments, but y'all will get me for as many questions as you have if they have to drop off. Okay, thank you.
You'll do fine, Congresswoman. Thank you, Senator.
Thank you so much, Congresswoman.
Hi there. This is Sandhya Raman from CQ Roll Call. I was curious, there's been a change in the Senate and the White House, and I'm just curious if you see a easier path forward to the Momnibus now, or if you have any commitments from leadership to kind of move this forward.
Well, we are certainly very excited. We have 2 bills that are bipartisan at introduction. We have 80 co-sponsors in the House, and we are, moving forward in the legislative process. It is my goal to have these, at least some provisions signed into law this year. And so we are working with that sense of purpose and urgency and laying the groundwork to make sure that leadership is well aware that these bills are coming their way.
And if I may add, Congresswoman,
Yeah.
that please remember that one of the leaders of the Momnibus in the last Congress is now the Vice President of the United States of America. And so I know of the White House's commitment to issues of racial equity and to address the severe gaps we have in healthcare provision and outcomes in this country. In addition to that, I'm proud of, in the Senate, seeing a vast group of senators from every sort of degree of our spectrum, from conservative to progressive, in our caucus, stepping up to be a part of this larger effort. It gives me a great sense of encouragement that we can get a lot of these common sense bills into law. And with the House of Representatives and the commitment of Chuck Schumer, I have a lot more confidence in partnership with the White House that we can get a lot of this done.